Welcome back to the Chronicles of a Ghanaian Diaspora Nurse, The Return. Thank you so much for tuning in again. Today, I'm so happy and honored to be hosting my former head of unit, former boss, when I used to work in Ghana many years ago. And I have followed her career progression and been inspired by what she's achieved both academically and professionally. Thank you so much for coming and sharing your thoughts with us, Dr. Mrs. Jemima Dennis-Antwi. Thank you.
Thank you very much. It's a privilege and an honor to have this interaction with you. Thank you very much. And it's good to see you again.
We'll talk more about our work together when we get there. So, could you just tell us about your professional role at the moment?
Thank you. Currently, I would say that I'm more or less an independent professional, serving the role of an international maternal health and midwifery technical specialist, working as the president and the CEO for an NGO, international NGO called Center for Health Development and Research. It's a purely systems development organization that looks at systems strengthening, health professional development, and then also, I would say, research. To be brief, I have other areas of health education, sickle cell disease, and other interest areas of health that I also deal in. Basically, what I have been doing all my life.
Thank you so much. So, about your career, I know you've touched on a few of them, but can you tell us a bit more about how it started, your work with Ministry of Health, the Health Education Project, which is where I first met you, then your experience of, studying abroad and working with various international agencies?
So, well, it's been an exciting, long journey and also a journey of many lessons learned and privilege of many opportunities, having learned under very renowned and hardworking leaders who have helped us to come this far. I would say that I joined the Ministry of Health as far back as 1989. I was very young then, and was posted to Ridge Hospital, where I was serving as, that time they used to call it a temporary staff nurse, but hoping to be upgraded to a nursing officer grade. So I was working in the clinical field. And then in 1990, there was then a new project that was coming to Kumasi, specifically with the Kumasi Metropolitan Assembly, and to be hosted by the Metropolitan Health Directorate. And therefore, I had the opportunity to be interviewed and be recognized for the position as head of unit. It was a new project basically focused on health education. And I had a technical assistant officer in the person of Glenn Lavrak, who was a British and working with the Overseas Development Agency. Now it is called the Foreign Commonwealth and Development Office of the UK. So together with colleagues like you and many others, we initiated the Kumasi Health Education Project, which looked at public education, development of training of health workers. We looked at environmental sanitation and so many others. And over the years, we were able to craft a niche for ourselves that looked at helping to update public knowledge about certain common diseases, especially communicable diseases, and then also the most common non-communicable diseases like hypertension and diabetes. And we also had little projects that were looking at environmental sanitation, looking at malaria prevention, and all those created the opportunity for us to interact with the public and to help the public to better understand health protection and how to prevent diseases. And all these were very exciting periods. For me, I would say that it was both a learning platform for me and also the opportunity for me to also diversify my exposure, work with colleagues, both national and international, and also upgrade myself educationally. Because when I joined the Kumasi Health Education Unit, I had my first degree, and through that, I had the opportunity to go and study at Edinburgh University for my master's in health promotion. So that gave me a lot of exposure around working with international colleagues, helping to understand diversified cultures, and also helping you to appreciate that your perspective to life may be very different from the other perspective to life. And the issue is, how do you bridge? How do you, with these diversities, how do you bring these diversities on board to even begin to work together within the health system? So for me, I think that these were all great learning opportunities for me. I also had the opportunity to go back to the UK to do my PhD at De Montfort University in Leicester. And again, I would say that that was also another aspect of being able to bring two worlds, learning from the UK system, applying it in the Ghanaian setting, because I was conducting my study in Ghana whilst I was a student in the UK. So I had to be coming down to collect my data to be able to write my thesis. So again, I had to see how to blend two worlds, how to look at the policies within Ghana, the international policies in terms of health improvements, in terms of social sciences and social beliefs, culture, and how all these play on health, and how you can then, as a health professional, bring all these on board to be able to impact communities.
Thank you very much for that. Wow, that's a lot of achievements there. But I just quickly want to go back to the health education era, because that was the first time I met you. I was a school health nurse. I can't even remember how, but I remember being interviewed by you and I think Glenn. I joined the project in 1991. But I must say that, I mean, like you said, the project really opened up opportunities. I think for most of us who started that project, most people got the chance to travel abroad to do courses and come back. So coming back to all that you've achieved up until now in terms of being, traveling abroad, knowing, experiencing the different the other aspects of healthcare and bringing it back to Ghana. So I think that you are well placed to talk about the diaspora and what they bring back in terms of supporting development back home in Ghana or in Africa. But before we go on, can I just ask you that what's your greatest achievement in all your career? I know you wear so many hats that we haven't even talked about. You've done a lot. If you can permit me to say some of them, you were the first president of the Ghana College of Nurses and Midwives. You helped set that up, and you are the acting rector. And you sit on the boards of many international organizations. So I just wanted to find out what is your greatest achievement in your whole career. If you can pinpoint one.
Okay, I would say that generally one thing leads to the other. And as you rightly said, yes, I wear a number of hats. Some have been completed, and therefore I've moved on. So yes, I remember from, if I may, when I left from Kumasi Health Education Unit, we metamorphosed into the National Health Learning Material Center, where we moved strictly into more of health professional workforce development, looking at continuing professional education, so strengthening our professional nurses, midwives, doctors, lab techs, and even schools and resource officers in libraries, trying to update their knowledge in terms of quality care and also competency building in terms of knowledge and skills development. And then also we had the opportunity to also engage in a collaborative research project with the Children's Hospital of Philadelphia, where I was the education coordinator for sickle cell disease care in terms of establishing the newborn screening for sickle cell disease program.
That's very well. Yeah. We're going to
Kumasi.
Kofanochi every week.
Exactly. And that again was a big eye opener for me. It sort of helped me to unleash a lot of potential that I never knew I had. And therefore, through that also, I got a lot of exposure internationally through conferencing. And it was through one of these international conferencing that I began to consider my PhD degree and to want to actually go. I had been thinking about it, but it was like, there I decided that I will now go in and do my PhD. So I think that all these exposures help you to shape your potential and also your life purpose. But what I would say has been my greatest achievement is being able to do something with yourself, being able to achieve, because the opportunities were there. You were able to take the opportunities that were. I believe that each and every one of us gets opportunities. The issue is, are you able to recognize the opportunities when they come? Are you able to make the best out of them? And therefore begin to unleash your potential for moving from one level to the other. So it starts with a level, the next, and then you move on. So I would say that my greatest success has been being able to explore the opportunities that come my way and to make these opportunities add value to myself. So being able to play the roles of the Kumasi Health Education Head of Unit was a first level achievement at a very tender age of about, let's say, 26 years, 27 years, moving on to become the project manager for the National Health Learning Material Center, playing the role of education coordinator for the sickle cell project, moving on then into the international arena. I left the Ministry of Health as a Ministry of Health employee in 2003, and then went in to do my PhD. And when I came back, I joined the international NGO system, and that involved a lot of travel, a lot of work within over 10 countries in Africa, where I was providing technical backstopping to these countries, and that meant traveling back and forth to these countries to support midwifery strengthening. And this was a new project that UNFPA and ICM and WHO had come together to implement. And it was actually in reaction to the Millennium Development Goals initiative and the need to increase the number of midwives in countries, because we wanted to address the poor maternal health indices. And therefore, moving from there, I moved into board service. I was doing a lot of work around serving on boards. And then, of course, my role as the president of the Ghana College of Nurses and Midwives, which was a national role that was assigned to me to actually work with colleagues to establish the college. So under my term of office, I was able to lead in establishment of the administrative system as an acting rector role, and then also in the establishment of the academic sector as the president and chairman of the academic board. So by the time I was leaving office after my end of term in 2018, we had started 8 specialist programs, and then 10 specialist programs, and a lot more were in different stages of development. We started with about 35 residents, and currently I learned that there are over 400 residents in various programs at the college. So the college, of course, is an institution of perpetual status. It will be progressively be producing specialists over time and in so many disciplines. So I think that for me, being able to, if I may use the word, sacrifice your comfort and your opportunity, I would say it's an opportunity. Again, it comes with deciding whether you want to grab that opportunity, because they don't come easy, and being able to contribute your quota. I think that these all have been exciting learning experiences for me, opportunity for me to meet so many diverse people from so many countries, and having the opportunity to travel far and wide. All these, right from starting from Kumasi Health Education Project to all these roles, have sort of tended to further develop me, build on layers and layers of experiences and expertise, which I would say today, all of them come together to make me who I am today, and or what I'm able to give back to society today. And I would say it is an opportunity that I've not regretted, and I'm grateful to God and to all my mentors for making that possible.
Wow, thank you so much. I mean, what you said is right, seeing the opportunities and taking advantage of them. And that's really the key. So thank you for that. And as I said earlier on, that I have kind of followed, not stalking you, but I've kind of followed your progress. And we've kept in touch all this time. And I must say that I'm really inspired, and probably mentored me indirectly. And so your career, development has really inspired me. So thank you so much for that. So this leads on to
Thank
the
you too,
next.
but I think I have to also say that you have also come very far. You have done a lot for yourself, and that also is a very big inspiration to you. You definitely also have a story to tell, and I believe that you should tell it to your colleagues, especially community health nurses in Ghana, and therefore you have an assignment for yourself.
So this leads me to the next question I want to talk about, and it's nursing leadership. Obviously, from all that you've done, you've been in several leadership positions. And we're talking about nursing and midwives because this is what we know. That's our profession. So what would you say in Ghana? What are the strategies in place for nurses and midwives to develop their leadership skills wherever they are, in a senior position or forefront of care?
Again, I'll go back to some of the virtues that I mentioned earlier, and to say that I think the Bible tells us that whatever your hands find to do it with all your might, because where you are going, there's no work. And there's also a saying that even if you are a cleaner in a presidential palace, clean as if you are cleaning the president's bedroom. And I think that that's, for me, has been a very good, let's say, form of value that I always go by. There is the need to look at hard work. Hard work. It doesn't matter the work that has been assigned to you, but when you shine the corner where you are, that light cannot be hidden wherever you are and in whatever you do, because unknowingly people are watching you and taking cognizance of the potential that you have. And that is what will move you from that position to another position. And each position that you move to adds value to you and exposing you to a whole new world. There's also the issue of self-discipline. Nobody likes to be told what to do, but you can only enjoy the ability of not being told what to do when you show that you can work independently, or you don't need to be told to do what you have to do. And therefore, self-discipline is very critical to be able to acquire leadership. You need also to be reliable. When you say you do this, make sure you do it. And then time consciousness. You cannot take forever in anything, because every day is time. And time means money, time is work, time is achievement, time is success. And therefore, you need to be bound by time. When you are given time, strive to achieve that time. If not, then it is important that you explain why and you ask for a little bit more time, but you cannot have time forever. Again, the quality of your work. It's better to be thorough and for them to say you have overpresented than to underpresent. Because when you overpresent, it's easy for you to take out and get, or they see the whole rather than the bits and pieces. So the quality of your work is very, very important, because it challenges you to do your best. And then also, propping yourself up for independent work. You can only become a leader when the little that has been assigned to you, you've been able to excel in it. And then through that, you are given more responsibilities that moves you into leadership role. Depending on your level of placement, you can even be plunged into a leadership role right from the outset, like I had the opportunity to be plunged in. And therefore, I had to learn to be a leader, to lead whilst learning. Because, I mean, there's a saying that some leaders are made, some are born leaders. I think that for every individual, you have the potential to be a leader. It is you making yourself available to be a leader. Leadership role will come to you. There are some people who decide that, no, I don't want to be lead. I don't want to be, because it comes with a lot of challenges. Of course, leading is not easy. Leading is not easy. So it comes in. So if we are looking at strategies for putting nurses and midwives into to develop their leadership skills, I believe that, again, it's a matter of what you yourself, what really do you want? When you know what you want, it makes it easier for you to be able to pursue the leadership role, even if it means a lot of giving away of yourself. So you have to be clear in your purpose. You have to learn to see advantages or opportunities and take advantage of those opportunities. You have to add value to yourself, either through education, through observation, through mentoring. Learn to engage yourself in mentorship. There are always senior people out there who need young people to work with them. If you make yourself available for service, they will work with you. And as you work with them, you learn the rudiments of the profession, and they also expose you to better opportunities. So, for example, you have a senior professor who maybe is engaged in research. She needs some people to collect data. You are going to, you join the team and you collect data, you do well in the data collection. Next time when there's another research, you call you again. So you are equipping yourself with the data collection skills, which will come into usefulness when you are going to do your master's degree, when you're going to do your PhD. So whilst people are struggling with how to design interview questions, you are way past that. So experience actually helps a lot. Therefore, what I would say that strategies, you need to make yourself available for service. You need to learn by doing. Competency building, nobody can. And when you know how to do it, nobody can take it away from you, because it's a skill that you have acquired. It is your own, and you apply it as and when you need it. Another strategy also is to remember that there is no useless learning. There's nothing that you learn which you think, oh, this has not been useful, because a time comes when what you learned in the past becomes very key for you to be able to occupy a certain position or even take up a certain appointment. So learning, I would say, is both integral and also formative and exponential, because you add on to the other, and all these come in to help you to lead. And then self-discipline, quality work. And I believe that being guided by your spiritual faith. And I would say, from my point of view, my belief in God, asking for spiritual guidance, asking for divine direction. I think that these are strategies that help.
So it's true what you said about the fact that the person has to have that drive, that ambition, that willingness to strive to improve themselves. Because if that is absent, no matter what you put in place, they're not going to succeed at being a leader or leading in whatever field they are in. And also, one thing I wanted to touch on, you mentioned that people can lead. You don't have to be on top to lead. Wherever you are, you can lead from the bottom, can lead from the side, and then you can lead from up. 360-degree leadership. The other thing that I also wanted to touch on was the fact that wherever stage you are on, and then whatever you learn, it always comes in handy later on, because some of the work I've done, even with the teams that I work with I work in the NHS, and sometimes when there are quality improvement projects and things, and I draw back on my experience from the health education unit, all the data collection skills and all those studies that were done, they really come in handy, which I was really grateful for. So it's really important, not to discount every learning that we get along the way. You never know when it will come into use to be useful for you. Whoa. Okay, so the next question I was going to ask us, what are some of the challenges encountered by nurses and midwives in decision making? And I know in Ghana, years back, I was aware that there's a lot of decisions that are taken not by nursing leaders, but but they have to, adhere to whatever policies or things that have been agreed. So what are some of the challenges? Is this still the case, or do nurses have a voice, and midwives, to make decisions concerning their work?
So I would say that generally a lot has changed since you were in Ghana. There's been, of course, the academic development of nurses and midwives at various levels of qualification. So depending on your qualification and your position, it determines your level of decision making that you can make and the level at which you also relate to other health professionals. And therefore, I would say that that determines the level at which you are able to make decisions. Now, when it comes to policies and policy implementation, now nurses and midwives are represented at the policy decision making because at the Ministry of Health, we have a head of nursing and midwifery, and then at the Ghana Health Service also, we have a director of nursing and midwifery. So I would say that nursing and midwifery issues are directly handled by them. But for the fact that nursing and midwifery cuts across most of the disciplines within the healthcare systems in terms of service provision, it means that you are having to relate with other professionals, and that brings in interprofessional issues, and then also let's say rivalries, and that sometimes affects the level to which you are able to make a decision, especially depending on your level of engagement with them or the positioning that you are in. That said, I would say that nurses and midwives have a lot of potential that I think is often untapped. And by so, again, is because of, if I may use the word, stereotyping. There's a lot of stereotyping in our profession to think that, excuse me to say, every nurse or every midwife is just there to take instructions. And therefore, the tendency for people to think that you are not capable of doing this, or it is not your responsibility to do this, even though there's work to be done and nobody is doing it. So I think that sort of undermines sometimes the abilities to take decisions. But I believe that if the decision is within your purview of operation, you should be able to take the initiative to take that decision and make sure that you know what you are about and then explain yourself. Currently, there's now the digitization of healthcare services. So now we are no more using folders and writing. Everything goes straight into the computer. So you are prescribed a medication, you even go to the pharmacy, they cost it, you go to the cash point to pay, and all this is from one computer to the other. So nurses are having now to apply their computing skills to be able to input into the nurse care that they have to provide. When you look, for example, at the role of the midwife, midwives are accountable for their actions in terms of the spectrum of normal delivery. And therefore, over 80% of services that midwives provide around sexual, reproductive, and maternal and newborn care, they don't need to be consulting the doctor at every point in time. There are midwives who are into independent practice where they take care of mothers from the pre-pregnancy stage, post-delivery, and that kind of, where they are in charge of CHIPS compounds, of health posts, of the maternity units, and until there's a complication, they are the ones who manage the pregnant woman. And this is a big policy decision that government has given to midwives to be able to apply. But this same midwife working at the district, the sub-district, the chief zone, if she finds herself in the teaching hospital, she realized that the privileges that she used to enjoy when she was making decisions on her own at the lower level, now she has to contend with the OBGYNs or general practitioners, because they are going to say, this is my purview. I'll not allow you to take these decisions. So you realize that, again, depending on the level at which you are operating, or the facility within which you are operating, your decision-making skills may be compromised.
Yeah.
Not that you are not able to, but interprofessional issues prevent you from taking those decisions.
Depending on the hierarchy on whichever unit in the city or the big,
Another typical example that may be based on when you used to be working in Ghana and what happens now in terms of management of human resource is nurses and midwives and their relationship with human resource officers. When we used to be very young and knowing the profession, a lot of management of the nursing and midwifery human resource were done purely by nursing and midwifery leadership. Now, when you go into a lot of facilities, there are human resource officers who deal with the human resource of the facility or the jurisdiction. And there's always been a hue and cry because nurses feel that the human resource officers are not well informed about how the profession works.
They are not clinical, as they will say.
The clinical background, they don't have the clinical background that allows them to appreciate the work of the nurse and the midwife, and in terms of certain postings or transfers that are done. And this sort of also brings interprofessional disagreements or frustrations around policy and policy decisions and that kind of thing. And there are times when nursing leaders have become very concerned because nurses and midwives have been transferred or moved from point A to another point without they being informed that human resource officers would transfer them without consulting them. And it sort of creates anxieties around quality of work and delegation of duty and that kind of thing. So these are some of the challenges that has to do with policy decision making and that kind of thing. Another last point that I would like to make, I don't know whether it fits under this, but the issue around opportunities for nursing and midwifery practice. There is this tendency to think that if you don't teach, you either teach or you be in the clinical, the bedside.
In terms of career progression, is that?
In terms of career pathway.
Okay.
So there's the tendency to think that, well, if I don't teach, then I have to be at the bedside. But there are so many things that nurses and midwives can do, but it has to be with repositioning themselves, reorganizing their career pathway, and deciding that they want to go the extra mile to explore other avenues. And I think that is also another area of mentoring that I think we all have a responsibility for, including our diasporan colleagues, to begin to conscientize the young and upcoming nurses and midwives to look at exploring other opportunities. Because
pathways, career pathways. Okay. I think this has led us nicely into the next question I was going to ask. The African diaspora workforce. It's believed that we are integral to the development of African countries. I will say in this case, Ghana. So what's your take on that? I know you've touched briefly on that, but what's your take on that?
Okay, I think, yes, definitely African diaspora workforce are definitely important to the development of Africa because, again, your rich experience, if given the opportunity to impact on the local scene or the local system, I think that it brings a diversification and also opportunity to adopt the goodness of the diasporan world and adapt it to the local situation. And therefore, there is definitely the need for creating that opportunity that allows the local professionals to intermingle with the diasporan professionals in order that there will be an impact or a rubbing on of strategies and diversified way of doing it, and also doors for networking and collaboration. However, I know that it has not been easy for diasporans to come home and be able to integrate or settle in because of, I would say, cultural differences. Where culture is work culture difference, mainly it is the work culture difference, because most of these people are Ghanaians already, but the work culture makes it very difficult and frustrating. Frustrating for them to be able to adapt and work with.
What makes it frustrating?
Okay. Again, because I've had the best of the two worlds, I think that I can comfortably say that it is frustrating because where you coming from, time is of essence, discipline is of essence, hard work. You have to show hard work to be able to keep your head above water. Whereas in the local culture, there are opportunities for people to take their time to achieve a purpose, because the level of demand for success is not as high as it is in the local scene compared to the diaspora. So whilst you come in with all the energy to say this must be done, the local colleague sees, oh yes, it needs to be done, and it will be done. Be patient.
It will be done.
Exactly, it will be done. So it sort of tries your patience, and then it's frustrating because things are not as seamless as you would want it to be. Procedures are not as seamless as you want it to be. In the diaspora, everything is written from step 1 to step 10 in black and white. In the local setting, steps for achievement of objectives may be reviewed at any point in time, depending on whoever is sitting in the seat. And therefore, that information may not even be available to you, the diasporan colleague, to be able to know whether you are in step 1 or you are in step 5 of the process of engagement. So again, that can be frustrating. But I think that some people have been able to find a way around it. And more or less, I would say, keeping the faith. If you decide, talking to people who have been able to succeed, how did they do it? And learning the strategies from them. And then keeping a network with colleagues, because it is difficult when you want, as a diaspora nurse, to come and want to implement it directly with yourself. You need to network with the local colleagues and work with them to implement it. Because number one, you don't know the terrain. Number two, you don't, sometimes you are not very conversant with the strategies for getting work done from people, even though they are supposed to do the work. You sometimes have to use, adopt certain strategies that will enable work to get done. You need to look at areas of collaboration, so that instead of doing it yourself again, can you collaborate with a certain agency, a certain department, a certain office in order to achieve the objectives? And these collaborations could be in the area of research, mentoring, conferencing, youth empowerment programs. All these helps you to bring your knowledge or expertise to share at the local level without having to be down there, having to turn every knob and having to open every door. Some of the doors can be opened for you through networking and collaboration, and then you come in to bring your, and then you have this sustained relationship. So you have collaborators on the ground who you work with. So it makes life far palatable or more accepting, I would say, for you.
It's all right, you know, it's all right. I mean, I can relate to that experience in the past where we've come to do teaching and skills share. It's always been the contacts have been made prior, you know, before even the actual visit happens. So I think in a way you've answered part of the question I was going to ask, that how might we bridge the gap between the African diaspora healthcare professionals and the healthcare professionals back home in Ghana. But I think you've touched a bit on there about mentoring and, you know, maintaining the contacts before you come. I just wanted to ask a question about NMC, I mean, registration. Maybe at some point I need to maybe talk to somebody within the NMC to, you know, talk about the process. How is it? Because I remember years back, I think it was 2013, or I tried to like verify my registration in Ghana, but I think the NMC sent the information to Ghana and I didn't hear anything. But I didn't pursue it. But I'm just asking how easy, if a nurse or midwife is here and they want to maybe come and share their skills. I know people come for short term, others come for longer periods. So what is the duration, the length of duration that one requires to have a registration in Ghana before they can practice? Because when we came years ago to do those two weeks training, we didn't do the NMC registration. In terms of how, what's the duration, that if somebody say wants to come for a month or 2 weeks, do they need to go through registration with NMC before they come? And if so, how easy it is for people to go through the process? Sorry,
Okay.
I'm throwing a lot, but
That's okay. I'll try to answer, and
yeah,
then later on, as you rightly said, it will be great opportunity for you to interact with the Nursing and Midwifery Council of Ghana. So I know that again, the Nursing and Midwifery Council of Ghana has seen remarkable improvements over the last few years in terms of how they structure their systems and then also information access. A lot of this information is at their website. So now, depending on what you are coming to do, if you are coming to have a collaboration or a network with another sister agency, I don't think that you necessarily need to register with council to be able to have the interaction with them. For example, you are coming for a conference, you are coming for a collaborative meeting. You don't need to go and register with council before you can interact with that sister agency of yours. But where you want to enter into the clinical system, there's a whole procedure because you have to apply, and then when you come, they have to, I think you do a test, then you have to do adaptation and all that so that you can acclimatize with the Ghanaian system. So it depends very much on what exactly you want to do. That will determine how long you have to interact with the Nursing and Midwifery Council. And now, again, based on your background, based on your expertise, that will also decide where the extent to which you have to go to renew your PIN, because they want to know the CPDs that you have had in the last year. Have you been able to build a level of credit that will enable them to renew your PIN for you? So it's all very circumstantial, but a lot of information now is available at the Nursing and Midwifery Council website that tells you that if you're a diaspora nurse, you want to come back home to practice, what you should do and everything. And then there's also the issue of verification of your license and that kind of thing. That one, most of the time, is agencies abroad which will write directly to the Nursing and Midwifery Council, and they deal with them at that level. So that's how they operate. So I will encourage you, check their website, and then if you don't get the necessary information, what you could do is that the agency that you are coming down to collaborate with could be a very good liaison between you and the council to be able to help you to identify what needs to be done so that you can prepare yourself for it.
Yeah. Thank you so much for that. I just want to quickly touch on the mentoring that you talked about. I know in this day and age of technology, you don't have to be somewhere to, to mentor someone. Do you think there's an avenue for e-mentoring? I've just coined that word, if there's a word like that. E-mentoring, where you can.
Now what we are doing is we are doing e-interview.
Yes.
So e-mentoring is right. I believe that yes, e-mentoring is possible, and actually is one of the interest areas that I've begun to work on as part of setting up my NGO, that is the Center for Health Development and Research, where we're looking at e-education, so people can actually access CPD courses online, go through the course and earn CPD points from the Nursing and Midwifery Council so that they can use to renew their PIN. And therefore, I have an accreditation with the Nursing and Midwifery Council as part of the NGO collaboration so that I can run e-programs. And therefore, an opportunity that we can explore is looking at how we can set up sessions with diasporan colleagues on certain areas of nursing and midwifery development, and we can actually expose our young midwives to these opportunities through networking, sending information, and people coming in. And it depends on whether this will be a sponsored program or people will have to pay to be able to participate in the session. So yes, it is possible, and the Center for Development and Research will be happy to explore this opportunity with you.
Sounds very exciting, and I think it's something that I would want to be involved in. Sounds very interesting. Okay, so the next question is, I know in all your answers, you've probably given the diaspora healthcare professionals some ideas and some information, but what would be your general message to health workers in the diaspora?
We have an adage that sankofa yinchi. I say chini ehwanya ekonechi.
Yes.
So when the drum beats, or when the drum gets off its hinges, it turns back.
It means that wherever you are, you can always retrace your.
Yes, you can, yes, and you can come back and add value to the system that you left behind. And therefore, for colleagues to in the diaspora to want to come back home to help, I think that it is in the right direction. It also shows their love for the motherland. It shows that they want to impact the world that they left, and it also shows that they are also development oriented. That's what I believe, and therefore I like them to keep the faith. They shouldn't give up because they've tried it once and it didn't work. I believe that they should use the networks, they should use collaborators, they should use local interactions rather than wanting to implement the thing directly themselves, but they can identify reliable entities to engage with, to work with. I also believe that they can be a link in terms of accessing global resources to be able to impact on a cohort of professionals. They could also act as mentors and also engage in youth empowerment initiative, because we have a large cohort of very young nurses and midwives who actually need a lot of support and direction in career building and career development. And therefore, it's a big area that I believe our diaspora colleagues can begin to look at. I mean, we have so many nursing and midwifery training colleges in every region in the country. And some have as many as 200, 300, 400, 600 students. And imagine if once a year, just like you do abroad where you have motivational speeches by renowned individuals, you can have our diaspora nurses and midwives actually go into a school and have a session with students in the assembly hall, talking to them about your profession. I think it will begin to broaden their horizon and create an understanding that nursing is not just graduating from school, going to the ward and taking care of patients or going to the classroom to teach, but there are so many sides to it. And I think that, as I said, there's a lot that can be done. It takes focus, it takes keeping the faith and keeping trying even when you meet a few frustrations along the line.
Keeping persevering and not giving up. And one day, you'll make the impact. All right. Thank you so much, Dr. Mrs. Jemima Dennis-Antwi. If anyone wants to find out about what your department does, Center for Health Development
and Research.
How
Please,
can they? Yeah.
Yes, you can go to www.CEHDAR.com. You can visit our website and there are contacts there. You can also communicate with us. So we'll be happy to hear from you and look at possible collaborations.
Thank you very much. Thank you so much. It's been a pleasure talking to you. And then I hope that we'll catch up another time on another subject.